Welcome to Knee Health Challenge. We're on week 3, day 16. Today I'm going to be going over a little bit of heat therapy and how we can utilize that on tissues. And also we're going to be going over hamstring stretching, contractions, and how to improve the nervous system's connection to hamstrings specifically. So, as you can see on the left side of the video screen, you can see some hamstrings, or one part of them are going to the outside and some are going to the inside, which is incredibly important. So with the video here, let's get into some of that. So as you can see, if you want to heat up, ice pack, beautiful. And then from there, let's get over my face. There we go. More importantly. All right, so we want to put heat over the area for about 15 to 20 minutes. That beforehand will help mold the tissue much better. It'll help increase heat shock protein activation. Also, if we're going to utilize molding and stretch of any tissues, that is a good go-to. So 15-20 minutes, and then into either long lengthening of any tissues, but it also increases the blood flow to those tissues as well. So now we're going to get into stretching of the hamstring. So what I want you guys to do is keep that heat therapy in the back of your mind as you go through any type of stretching. It also works incredibly well for like arthritis. I wouldn't use any heat over any areas that are swollen or have a lot of swelling, because that will increase inflammation, which will delay the healing itself too, because you have to get the waste products out in order to increase the healing rate overall. So as we go into stretching the hamstrings, with this, much of the same with any type of stretch we want to do, we need a minimum of 2 minutes holding that specific tissue a day. So as you can see here, your leg can be straight ideally, so everything's lengthened. You can turn into internal, external rotation. That doesn't matter too much. Explore a little bit. After the stretch, very important, put pressure of your whole leg down into the table. For most people, 25 to 50% intensity for 10 seconds, and then build up from that. Also, we're going to switch legs. Same thing, other side. You can turn internally, externally of the whole leg itself too. Wherever you feel most of the stretch that you needed more, stay along those lines of tension. And then same thing, put pressure of your leg down into the table, ground, what have you, for, like I said, 25-50% intensity. So as we go into contracting and controlling the nervous system to the tissues, what we first want to do is what I have right here, a little bit of an exercise band. Let's go back here. There we go. All right. So we want to hook a band or a rope of some sort around the bottom of the foot. And then from there, we're going to get into knee flexion. Now the purpose of this, and you can have your foot turn inwards, outwards, you can bring your leg in and out, but we want to hold the stretch for 2 minutes. After that, I want you to try to keep your heel to your butt or your glutes. And then as you can see here in a sec, what we're going to look to do is release tension, and you try to hold it there. And that's where the connection has come. So between passive range, or someone externally holding the foot in a direction, versus you actively controlling, there's a difference between those two, active and passive. And that is a huge difference in terms of what you can actually accomplish versus what you can actually control. Very important on that side of things. And the same thing, the other side, you can have your leg turn inwards, same thing, it turns outwards. Hold the leg to your glutes as much as you can, and relax and release it while you're holding there as well. And again, that's the difference between stretch contractions and controlling the muscles itself. So I want you going through that today. That is going to be incredibly important for most of the hamstrings, whether you lengthen it and put a contraction down, or you completely flex the leg and put it to full contraction and actually control everything as it's shortened. So there's both sides of the spectrum, controlling it as all muscles are lengthened or leg is straight. Also controlling it when all the muscles are together and the leg is shortened. It's the same thing with any joint from there. So give that a go. Again, focus on the time parameters. This is the challenge for today. Best of luck. We'll see you guys on the next one.